When you think about healthcare, we all want that feeling, right? That the care we get is the best it can be. Safe, high quality.
Absolutely.
Hmm.
But figuring out how that happens, how it's guaranteed, that's the tricky part. It's a really complex picture.
It really is. And well, that's precisely why healthcare accreditation exists, isn't it?
Exactly. These are the frameworks, the sort of guideposts that help bring some clarity. They give assurance that providers are hitting certain recognized standards.
Right. So in this deep dive, we're going to dig into two major players in this really crucial area. We'll be looking at Joint Commission International JCI, which is, global, and also the National Accreditation Board for Hospitals and Healthcare Providers, NABH. That's the key one in India.
And we've also got some really interesting insights into how new policies, the ones aiming to improve healthcare, are actually being put into practice.
Oh, the implementation side.
Yeah, and the role of organizations like iSQA, sort of pushing for better quality across the board worldwide.
Okay, so our goal today, our mission, if you like, is to get a real handle on the purpose, what these organizations actually do, and maybe most importantly, the real-world impact they have, on the quality of care you might receive and ultimately on patient safety.
Sounds like a plan. Where should we start? JCI.
Yeah, let's kick off with Joint Commission International. They're a pretty big name globally, right?
No, definitely. They're really seen as a leading voice, maybe the leading voice internationally on healthcare quality and patient safety.
And they've been around a while.
For over 20 years now, yeah, working to improve healthcare systems all over the place. What's really fascinating is how they maintain standards across such different, healthcare environments and cultures.
That can't be easy. And their mission statement really says it all: to enable and affirm the highest standards of healthcare quality and patient safety for all. That's quite a statement.
It's a big goal, yeah. And their reach reflects that ambition. It's pretty vast.
How vast are we talking?
Well, JCI is active in over 70 countries.
Yeah.
Across Asia, Europe, the Middle East, Africa, Latin America. I mean, they've accredited or certified over 1,000 programs globally.
Wow, okay. That really underscores their influence, a truly global operation. Now, JCI offers more than just like a stamp of approval, right? What do they actually provide?
You're spot on. It's much more comprehensive than just a certificate. Their core, of course, is the accreditation programs themselves for all sorts of healthcare settings, hospitals, labs, primary care.
Okay.
But beyond that, they offer specialized certifications too. Things like clinical care program certification for specific diseases or conditions.
Right.
And even, interestingly, a healthcare sustainability certification, which looks at, environmental impact, social responsibility.
Sustainability in healthcare, that's a really growing area, isn't it? Definitely something to keep an eye on.
Absolutely.
What other kinds of support do they offer organizations going through this?
Well, they have quite extensive advisory services to help places prepare, sure, but also just to improve in key areas.
Like what sort of areas?
Like quality management systems, patient safety protocols, infection prevention and control, always huge. Medication management, facility safety, even emergency management.
So the real nuts and bolts of running a safe facility.
Exactly. And they have tools for that too, like their high reliability maturity assessment and specific training programs designed to build those consistent safety practices. To make it culture, really.
Right, building that foundation, that culture of safety, not just ticking boxes for a survey.
Precisely. And they leverage technology, too. They have online solutions like tracers with AMP. It's basically their platform for ongoing performance monitoring.
Ah, so it's continuous.
Yeah. And their publications are key as well. The standards manuals themselves, they're the rule books, really. But they also publish white papers, journals, sharing best practices and, new thinking.
And you mentioned standards. A core part of that must be the International Patient Safety Goals. What are those exactly?
Yes, the IPSGs. They're really fundamental. They target specific, known high-risk areas in patient care. Things like making absolutely sure patients are identified correctly, right patient, right procedure. Improving communication between staff so crucial information doesn't get lost.
Handover problems, yeah.
Exactly. Ensuring high-alert medications are used safely. Preventing wrong site, wrong procedure, wrong patient surgery, the never events, reducing healthcare-associated infections, minimizing the risk of patient falls.
Okay, so really practical, high-impact areas.
They give accredited organizations a very clear roadmap for tackling these critical dangers.
That makes sense. The JCI website also features testimonials from accredited hospitals. Did anything stand out from what they were saying?
Yeah, there were some really consistent themes. Hong Kong Adventist hospitals, for example, talked about big improvements in teamwork, how communication just flowed better between departments after going through the process.
Interesting.
Burj Farha Hospital in the UAE mentioned gaining a competitive edge, sure, but also building stronger trust with patients.
Trust is huge.
Definitely. Emirates Specialty Hospital highlighted the added value and saw increased patient confidence. And Corniche Hospital, also UAE, emphasized that accreditation showed their ongoing commitment to excellent care.
So it really seems to go beyond just meeting the standard. It sounds like it actually fosters a better working environment and strengthens that patient relationship.
I think that's right. It suggests the whole rigorous process encourages a deeper dive into best practices, a more sort of joined-up approach to delivering care.
And just before we shift gears from JCI, they mentioned a Unify 2025 conference. What's that about?
Ah, yes. Unify 2025 looks like it's going to be a pretty significant event, a place for healthcare pros to get together, share what they're doing, strategies for tackling today's big healthcare challenges.
So another way they foster collaboration.
Exactly, facilitating that learning and networking on a global scale.
It's valuable. Okay, let's pivot now. Let's turn our attention to India and the National Accreditation Board for Hospitals and Healthcare Providers, NABH. What's their role within the Indian healthcare system?
So NABH is basically an independent board that sits under the Quality Council of India. Its main job is to set up and run accreditation programs specifically for healthcare organizations in India.
Okay, so a national focus, unlike JCI's global one.
Precisely. While JCI operates internationally, NABH is really tailored to raising standards within the Indian context.
And what are their main objectives there?
Well, their primary aim is to establish benchmarks, standards that will help drive progress across the Indian health industry. They work to make sure quality and safety standards are met, ultimately serving patient needs.
Right.
And it's interesting, while they get support from stakeholders like government and industry, they operate with functional autonomy.
That independence must be important for credibility.
Absolutely. It helps maintain the impartiality of their whole accreditation process.
Makes sense. The NABH website also has some quick links. Anything useful jump out there?
Yeah, a couple of things. They provide access to a digital health toolkit, which is likely, a set of resources to help Indian healthcare organizations navigate the whole digital transformation piece.
Which is happening everywhere.
For sure. And they also have a system for verifying training certificates, which adds a layer of trust and security for the workforce, making sure qualifications are legitimate.
Digital tools, verification. Seems like they're using tech to boost quality assurance, too.
Mm-hmm.
Okay, now let's bring in Supremedic Consultancy. They seem to work closely with hospitals, helping them get accredited. What's their role?
Yeah, Supremedic positions itself as a partner for hospital owners, offering pretty comprehensive support, actually, right from the early planning stages of building or setting up a hospital all the way through to getting that accreditation.
So they're involved from the ground up, not just the final accreditation push.
Seems that way. Their services cover a really wide range: hospital design, planning, helping recruit staff doctors, nurses, and crucially setting up those quality management systems.
Which are key for accreditation.
Exactly. And they specifically highlight their NABH implementation and accreditation support. For all sizes, it seems: small nursing homes, medium hospitals, large multi-specialty centers, even diagnostic labs.
So quite a broad scope. And it sounds like they aim to simplify what can be a pretty daunting process for providers.
I think that's the idea. They also talk about their expertise in hospital strategy and quality. They mentioned Dr. Surta Ram Vishnoy's experience there.
Okay.
And beyond accreditation, they help with things like manpower planning, operations management, including developing SOPs, standard operating procedures.
Just step-by-step guides.
Right. And managing medical records departments, which is critical for information flow and patient history.
Yeah.
They even get involved in supplying medical equipment.
Wow. So they really are a kind of holistic support system for these facilities.
Seems like it.
I also noticed they mentioned an investment collaboration model. What's that about?
Yeah, that's an interesting angle. Supremedic says they can actually partner with businesses, investors, taking an equity stake in return for their strategic planning and execution on new healthcare ventures.
Huh. So more than just consultants, they become actual partners.
Yeah, suggests a deeper level of involvement, being invested in the success of the projects they help launch.
That's a significant commitment. Okay, let's zoom out again now. Let's talk about ISQA, the International Society for Quality in Healthcare. What's their overall mission?
ISQA's mission is pretty clear and inspiring. inspiring and driving improvements in the quality and safety of healthcare worldwide. They're a nonprofit, member-based group, been around over 30 years.
Inspiring and driving sounds like they focus on both the vision and the practical steps. How do they actually work towards that?
They do it through several key activities. They offer education, training programs. They facilitate sharing knowledge, best practices, globally. That's a big part of it.
Connecting people.
Exactly. They also provide external evaluation services, helping organizations assess their own quality. And they support whole health systems in their broader quality improvement efforts. They're like a global hub for the quality and safety community.
And like JCI, they've got a big international footprint.
They do. Their network spans over 70 countries, 6 continents, so they bring together really diverse perspectives.
The ISQA website mentioned upcoming conferences. What's on the horizon?
Right, their 41st international conference is set for São Paulo, Brazil, in October 2025.
Okay.
And the theme sounds really relevant. Inclusive health systems, navigating challenges with technology and humanity. Captures that tension, doesn't it? How to use tech, but keep care human and accessible to all.
That's a critical discussion right now. It's good they're fostering that dialogue through these big international meetings.
Yeah, they also list past conferences, like
Yeah.
Istanbul in 2024, so you can see the ongoing effort.
What about publications or other resources they offer?
They publish some important academic journals. The International Journal for Quality in Healthcare, IJQHC, it's a major one, and the International Journal of Care and Caring, IJCOMPS, places where research and best practices get shared.
So, contributing to the evidence base.
Definitely. They also produce things like the ISQA Green Paper, tackling key issues, and as I mentioned, various educational programs, including fellowships to develop future leaders in quality and safety.
So ISQA seems crucial not just for defining quality, but really empowering professionals with the knowledge and tools to actually do it.
I think that's a good way to put it.
Okay, let's shift now to the really practical side. How do these quality and safety policies actually get put into action on the ground? Our sources talked about innovations and policy implementation. What are some of the key new approaches we're seeing?
Yeah, this is where it gets really interesting, isn't it? Because having a great policy written down is, well, it's only the first step.
Right. Making it happen is the challenge.
Exactly. And we're seeing a big shift towards using technology, but also new ways of thinking to make sure policies actually get adopted and, have an impact.
The sources broke down some of these innovations. Let's start with digital health platforms. How are they changing things?
Well, digital platforms allow for real-time data collection and monitoring.
Yeah.
Which is just huge for understanding if policies are being followed, what effect they're having.
Can you give an example?
Sure. Like the EVEN platform in India. It tracks vaccine temperatures and storage in real time to make sure they stay effective. That's policy in action. Or DHIS2, used all over the world to manage national health data. It gives immediate insights into health trends, helps track policy adherence.
So moving away from paper records to live data streams means you can react much faster, adjust policies quicker.
Precisely. Then you have decision support systems.
What are those?
These are tools built to help clinicians, even administrators, apply policies directly in their day-to-day work. Think about Clinical Decision Support System, CDSS, built into electronic health records.
Ah, like prompts or reminders.
Exactly.
Okay.
Maybe guiding antibiotic prescribing based on current guidelines or reminding doctors about specific screening protocols. They help embed the policy right into the clinical workflow.
Making it easier to do the right thing. Okay. Another interesting one was micro-policy pilots or sandboxing. What's the thinking there?
The idea is basically testing a new health policy on a small scale first, in a controlled setting, before you roll it out everywhere.
Like a trial run.
Yeah. The Ayushman Bharat pilots in India, testing different bits of the national health insurance scheme, are a good example. It lets policymakers find problems, tweak the policy based on real-world feedback before a massive launch.
That sounds like a really sensible approach. Minimize the risk.
The sources also mentioned community-based monitoring. How does involving the community fit in? This is about engaging citizens, local groups, NGOs, in tracking how policies are actually playing out. Are they working? Are they fair?
How does that work in practice?
Well, things like Gyan Sunway public hearings in India, where people share experiences with government programs, or community scorecards, used in places like Uganda to rate maternal health services. It provides incredibly valuable feedback directly from the people the policies are meant to serve.
Right. Giving the community a voice boosts accountability, leads to better policies. Definitely.
Then there's behavioral economics.
Using psychology to influence health choices.
Kind of, yeah. It's about using our understanding of how people actually make decisions, which isn't always perfectly rational, to encourage healthier behaviors or policy compliance.
So.
Using nudges, subtle changes in how choices are presented. Using incentives smartly. How information is framed. Simple things like SMS reminders for vaccinations or conditional cash transfers that reward things like giving birth in a clinic. Small tweaks can have a big effect.
Fascinating. Okay, what about real-time policy feedback loops?
This ties back to the digital platforms, really. It's about using that up-to-the-minute data and analysis to get immediate feedback on policy implementation.
Like the COVID dashboards.
Exactly like the COVID-19 dashboards. Tracking infections, hospital capacity, vaccination rates, that data-informed constant adjustments to public health measures. It allows for much more adaptive, responsive policymaking.
So policies aren't static, they can evolve. Makes sense. And of course, artificial intelligence, AI. How's that being used here?
AI is popping up in several ways for policy implementation. Using predictive analytics, say, to identify populations most at risk for certain diseases so you can target interventions better.
Proactive rather than reactive.
Right. AI-powered fraud detection in health insurance schemes is another big one. And using natural language processing NLP, that's AI understanding text, to analyze policy documents or monitor compliance through reports.
So AI can bring more efficiency, deeper insights into managing policies.
Potentially, yes. The source also mentioned blockchain, which might seem a bit out there for healthcare policy.
Yeah, I associate that more with cryptocurrency.
Right. But its core features being decentralized, transparent, hard to tamper with, make it useful here too, for creating really clear, auditable records of policy updates or compliance checks.
Okay, I see. Like a secure logbook?
Kind of. You could even use smart contracts on a blockchain to automate parts of policy enforcement. And it adds security for sensitive policy data.
Interesting application. Okay, finally, gamification. Turning policy into a game.
Pretty much, making it more engaging. Healthcare organizations are trying things like policy compliance challenges, maybe with leaderboards, rewards, developing interactive simulations so staff can practice policies in a safe space, using team-based rewards to encourage everyone to take ownership.
Trying to make compliance less of a chore, more engaging, creative.
Definitely a different approach.
The sources also gave some powerful, real-world examples of these innovations. Anything particularly catch your eye?
Yeah, a few really stood out. Rwanda's rapid SMS system for tracking maternal care using simple mobile tech was linked to big drops in maternal mortality. That shows the power of digital health, even in low-resource settings.
Incredible impact.
India's PMJ-IT backbone, the system managing health coverage for hundreds of millions of people, processing millions of hospital claims digitally. Just the scale of that is amazing.
She shows it can be done at scale.
The UK's NICE implementation support tools, providing clear, evidence-based guidance and tools for clinicians that highlights the value of standardizing best practice. And Brazil's community health agents, using digital reporting tools on tablets, improved care continuity, especially in remote areas.
These examples really bring home the potential, don't they? It's also interesting they mention specific implementation science approaches like REAIM, PDSA, CFIR. Sounds a bit academic.
The frameworks, yeah, but very practical ones. They provide a structured way to think about how to put policies into practice effectively and figure out if they're working.
So REAIM.
That helps assess reach, effectiveness, adoption, implementation, and maintenance. Covers the whole life cycle of a policy.
And PDSA.
Plan, Do, Study, Act. It's a simple, iterative cycle for testing changes on a small scale, learning, and refining. Very common in quality improvement.
Okay. And CFIR.
Consolidated Framework for Implementation Research. That one's more complex, helps you analyze all the different factors, the setting, the people involved, the policy itself that can affect whether implementation succeeds or fails.
So it's not just about having the innovation, it's about having a methodical way to introduce it and evaluate it.
Exactly. It brings rigor to the how-to part.
The sources also noted how these innovations can help overcome common roadblocks to getting policies implemented. Like what?
Well, things like participatory platforms involving users in design can counter that feeling of top-down policies being imposed. National health stacks, or APIs, can break down data silos so different systems can talk to each other.
Which is often a huge barrier.
For sure. Real-time dashboards tackle the problem of slow feedback. And using gamifications, or those behavioral nudges, can help overcome resistance to change, which is always a factor.
Right. Addressing those fundamental challenges seems key. And importantly, these innovations are also being used to promote fairness, equity, inclusion.
Absolutely critical point. This includes things like using gendered analysis when designing policies, thinking how they might affect men and women differently,
Hmm.
using mobile health to health to reach underserved groups, maybe in remote areas,
Mm-hmm.
like the 99 DOPS program for TB medication adherence in India using basic SMS, and developing apps and tech that are accessible for people with disabilities. It's about ensuring the benefits reach everyone.
Making sure quality improvement doesn't leave people behind. Finally, then, how do you actually measure if a policy implementation has worked? What are the key metrics?
Well, you look at a few things. Coverage is one.
Mm-hmm.
How many people or what proportion of the target group is the policy actually reaching?
Okay.
Quality is another. How well is the policy being followed? Is it leading to the intended standard of care? Efficiency. How
Mm.
quickly, how cost effectively is it being rolled out?
Exactly.
And ultimately, impact. What are the measurable changes? Are health outcomes improving? Fewer infections? Lower mortality? Are healthcare costs changing? Those bottom line results.
Those measurable outcomes are really the proof in the pudding, aren't they?
They really are.
Well, this has been a really fascinating deep dive into accreditation, policy implementation. It's clear that ensuring healthcare quality and safety is this massive collaborative effort,
It really is.
involving global bodies like JCI and ISQA, national ones like NABH, partners like Supreme Medic helping on the ground, and then this whole wave of innovation in how we actually make policies stick.
Yeah, achieving those high standards, it's definitely a continuous journey. It needs the standards themselves, sure, but it also needs creativity, these innovative approaches to make sure they get adopted, improved, and actually lead to better care for all of us.
So, thinking about all this interconnectedness, global standards, local implementation, innovative tools, here's a final thought for you listening. What role can individual healthcare organizations or even individual professionals like you play in building that truly universal culture of quality and safety? How might these ideas apply in your own world? Something to think about. Thanks for joining us for this deep dive.